Greetings, everyone, and welcome to all our participants and to all our speakers. On behalf of our hosts, the Football Foundation for Africa and Policy Strategy Group, I welcome you to our webinar, Football as Infrastructure, Building Regional Solidarity for Women's Health. Maybe just before we get started and I introduce the webinar and our speakers, just a few housekeeping rules, if we can maybe just put them on the screen. Yeah, so please just ensure that your audio is muted. I think we will also ensure that it's automatically done so. If you have any comments, reflections, anything you want to share, please feel free to share that in our chat. Similarly, so we will be having a Q&A session at the end. So please feel free to pop your questions throughout the webinar in the chat, and we will be sure to see them. Please also note, very importantly, that the session is being recorded, and we will share it with all participants after the webinar. And if you do have any issues, whether technical and the like, please feel free to just pop a message in the chat, and our team will assist you. To our French participants, we do have closed caption, comment accéder au sous-titres to ce Zoom. So please do follow the instructions that are displayed on the screen. You may look to the bottom of the screen. You'll see a little button for show captions. Click this, choose your preferred language between English and French. If you don't see the button, there should be an options or setting buttons at the bottom of your screen where you can select captions as well and choose your language. Once again, if you have any issues, please pop a message in the chat. Thank you. Maybe I'm just going to start by introducing our speakers. For those I have not mentioned, my name is Tshiamo Molefe, Executive Director at the Football Foundation for Africa. Also joined by my dear colleague, the founder and president of the Football Foundation for Africa, Brian Wesaala, who is joining us from Kenya. We also have the founding partner and chief strategist of our other host policy strategy group, Spring Gombe, joining us from Germany. We also have Lindi Ngwenya, who is a founder and managing director of Sisu Sports Management Limited, joining us from the UK. And last but not least, Dr. Divine Cophie, who's a lecturer at the School of Sports and Exercise Medicine, the University of Health and Allied Sciences in Ho in Ghana. So welcome to all of you. Thank you. So as we sort of look to close off International Women's Month today on the 31st of March, we're gathering at a critical moment for our region, where across the continent, there's growing recognition that health is not just a social good, but is the foundation upon which productivity, resilience, and inclusive growth are built. This is captured quite powerfully in both the Durban Promise of 2025 and the Lusaka Agenda of 2023, which frameworks challenge us to think differently. They call for country-led, regional cooperation and sustainable financing models that move us beyond fragmented, donor-dependent approaches. But within this broader shift, there is unfortunately a difficult truth that we must confront, which is the fact that women's health remains structurally underfunded, underprioritized, and too often invisible within these systems. Despite being central to families, communities, economies, women and girls still face limited access to services, persistent gaps in sexual and reproductive health, and barriers that are shaped by inequality, culture, and geography. So these are not just health issues. These are economic constraints on entire societies. So the question comes, how do we move from commitment to connection, from policy frameworks to lived, practical, and accessible systems? And that's where today's conversation becomes both urgent but also innovative. And I think it also allows us to explore ways of looking at things more boldly than the status quo. So I'd like to start by inviting our first speaker, as mentioned, dear colleague of mine, Brian Wesaala, who will introduce us to the model of football as infrastructure. Brian, over to you.
Thank you very much, Tshiamo. And also it's a pleasure for me to be here to speak on the football as infrastructure, and today focusing on women's health, building solidarity for women's health. And again, to wish our women, some of them were here and also joining us as listeners, a happy Women's Month. We continue to celebrate you, but also looking forward to seeing you, get more involved in our space, traditionally male dominated. But let's see how can we, grow the participation of women in the development of the football and sports sector, not just as players but also as leaders. So it's a real pleasure and thankful for this opportunity to speak on football as infrastructure. I don't know whether I have control of my screen here. Thank you very much. Yeah, so what is football as infrastructure, or why this model as football as infrastructure? Just for introductions, I'm the founder and president of the Football Foundation for Africa, and I've been working in this space for the last 10 years. And what we have been trying to do is to see or explore how can we drive more investment into grassroots football specifically. And as Tshiamo has alluded in our introduction, there are challenges that we have to face. Top among them, I think, is financing. How do we finance football, especially at the grassroots level? So this is something that I've been exploring, or we have been exploring for the last 10 years. And it's what led us to this realization late last year in the run-up to the Fourth Africa Football Business Summit. In one of the conversations similar to what we're having today, we learned that football really is not entertainment, or football is not a charity, basically because corporations will not invest or finance football out of love for the game. That was a sobering reality for me in this platform when somebody remarked that corporations don't love sports and they won't give money out of pity. So the question that arose for me then was, how do we finance football? And in my continuing research and also building on the work that we have been doing over the last 10 years is when I came to the realization that really football serves as infrastructure for development. And at this point, I felt it was important that we reposition what football can do for society beyond its entertainment value, beyond its charity value that we see, and more so in Africa now we see football as a pipeline for talent, and that means a very extractive model, and especially in the men's game. But with where we are also with the women's game, we run a similar risk if we continue to operate with the similar models where our best talents will be extracted from the ecosystem without considerate benefit to the African football and sports ecosystem, and in this case, impacting our social and economic development. So closely tied to the football as infrastructure model, perhaps those who on the call will realize the sport for development model, which has been pushed for a long time. And from where I sit again, I realized with the sport for development model, we are still not attracting the scale of investment that we need to advance football and sports in general. And that's why the FAI model, rejects all these four framings of football and is pushing us to think about football differently. And it's primarily because of the ubiquity, the reach of football has, especially in our continent as Africa. So going to this comparison between the sport for development model and football as infrastructure, we can clearly from the outset see some differences in how we approach these two sectors and now and why a shift is required. First of all, in the sports for development space, football is used as a vehicle or as an instrument for external goals. And we know there are various programs, for example, that talk about football to drive health. We are seeing even football to promote girls' health, but it fails to recognize really football as a platform that already has intrinsic value, in that it already draws a lot of young people, and in the case for this today's discussion, it draws a lot of girls and women already. And as we note also in the ecosystem, there is a big drive to get more women and girls to participate in football and sports in general. Secondly, the sport for development model is very program dependent. So we have what I would say are short to medium term programs that are usually dependent on external funding. And therefore, when this funding stops, often these programs also stop. But with the football as infrastructure model, now we look at football as something that is structurally embedded in our society, and we can build these programs on top of the infrastructure that is already there. So this means that should funding stop, which is a reality that we have to face from time to time, the football doesn't stop. It still continues to deliver certain value, certain economic and social values that should be measured in this case, and that's something we'll talk about a bit later in our presentation. The need for us to have data or data-driven platform to drive investment into grassroots football, and in this case into women's football development. With the sports for development model, we also realize that a lot of value is actually imported from outside the system, as opposed to already recognizing the value that is present in football as an ecosystem. So we find ourselves more often asking ourselves, what can football deliver, instead of realizing what it already delivers and designing football development based on these realization. So this is very, very interesting and in my view very nuanced in terms of a shift, because both the sports for development model and the football as infrastructure model have the same ambition, have the same goals, and that is to drive social and economic development, including health, education, employment. But how we position football now is the different. Football becomes a starting point for what we want to do and not an option amongst others. So we are really anchoring our development on football, our social and economic development on football, and this is quite key in how we will look at football going forward, especially in the African context. Of course, other geographies are already doing this, but they have just not named it. But in Africa, the feeling is we need to name it this way so that we get the right kind of investment and the right people and the right approach to investment when it comes to developing football. And what this means, for example, is governments and our governments become a primary actor when it comes to development of football in Africa. Just recently, in engaging with one of our potential partners, they alluded to the fact that there is reduced ODA, official development assistance, that will be coming into the African continent, and the responsibility, of course, will be pushed to our governments. So how do we become more innovative to ensure that our governments realize the value of football and sports and help them to prioritize these in their national development plans? This is going to be very critical in driving social and economic development in Africa. So why do we describe football as infrastructure, especially when we want to compare to other infrastructures that we have? I know this can sound like a very difficult sell or a difficult concept to push across. But when you look at what we consider traditionally as infrastructure, then you start to see the similarities and why we need to, move to this model. So first of all, it's the enabling function of football, which closely resembles what we see in roads, energy, or digital infrastructure. Roads connect markets and people, whereas football infrastructure connects us to health, as we're discussing in this webinar, education, employment. And then there is the network effects. The more people we have using what we consider infrastructure, the more value we're able to derive from the same, similar to football. And now we are driving, more participation for girls in football. And if this is going to happen, then we are only going to realize more value. We're going to have a stronger community impact. Roads, energy, digital infrastructure also serve as public good. In terms of it's not just those who are involved in the game or playing that benefit. Yeah. So there is wider community benefits that come from investing in football and sports in general. And this is something that now also positions football as something that governments should primarily, invest in. And then, as we'll see later, we have to get a different approach in terms of how we engage, especially the private sector and the international, development player. The other thing is long-term returns. When we are investing in roads, when investing in energy infrastructure, especially at governments, we are always looking at what the outcomes are in the long term. So we are talking about, decades of investment and measuring the outcomes of our investment. And this is something that should also happen in the football space, because what we see now, and which is not working in Africa, and this is very evident in some of the cases that we are witnessing, currently, is that there is a lot of short-term investment. When you talk about sponsorship driven and sponsors come in short-term, and when they are not, their returns are not realized, usually they pull out. Similar to when we think of football as charity. So we have short-term projects and programs that are funded, and when the funding dries out, these projects stop. And this is something we need to get out of if we are going to realize the long-term benefits of investing in football as infrastructure. And this is very critical for Africa, because Africa, I usually tell people, Africa does not need more footballers. And in our case, Africa does not need more professional women footballers. This is just a reality that we have to deal with. But what Africa needs is an engaged and active, human capital. So we need to see how we position football and sports as an avenue for developing our human capital and investing from these perspective. And then, of course, there are the multiplier effects that we get from traditional infrastructure, what we consider traditional infrastructure. So they boost trade, they boost tourism, we boost manufacturing, similar to the sports space. And we see this especially when it comes to, events like, the East Africa region will be hosting AFCON 2027. We have just come out of AFCON 2025. Usually these what should be measured are the multiplier effects. So how many jobs are being created? What is the tourism growth surrounding some of these events? What are the health implications? What programs can we, for example, develop parallel to us hosting the Africa AFCON 2027 in East Africa that can help us to drive the health agenda. So these are very critical metrics that we need to start looking into and making sure that we invest in football for what it is, and that is infrastructure. And why does football already operate as infrastructure? Because it reorganizes community. We see it every day on most weekends, especially at the grassroots level. The tournaments that bring people together, shaping how communities engage with each other, shaping who become leaders. We're increasingly seeing, coaches, former players taking up leadership positions within our communities, all because of what football does when you think of it as infrastructure. Football also mobilizes capital, and we are seeing also a drive toward this in Africa. There is a push to professionalize our clubs, which takes a lot of investment. There is football academies are flourishing across the continent, and they are all looking to drive more investment into the grassroots space. So yeah, football is already mobilizing capital just the way it operates. And then lastly, it shapes governance norms. What we have again witnessed with AFCON 2025 and some of the outcomes from there are really speaking to models of governance. How do we manage outcomes from such a tournament? And an interesting concept that will actually, this is what is brought the Football Foundation for Africa and Policy Strategy group together, is around solidarity, the compensation of especially grassroots ecosystem. This is something that football is already ready to lend to another field, and in this case health. So we're really looking at something that has the potential to drive huge social and economic gains through some of the models that are already operating within the football space. And I believe most or some of the people in our audience or even in our panel might ask, why football? Why only football? And this is a question that I've faced over and over and again in most of the platforms that I have had the opportunity to engage, because there are other sports. There's basketball, there's rugby, there's cricket, there's kabaddi that we have gotten from. So why football? And for a long time, I was explaining this as a matter of passion, or in a game that I participated in. But when we came to this realization of football is infrastructure, it was no longer just about passion. This is something that we observe quite well in the mall space. We have shopping malls across the continent, and they usually have what they call um, the anchor tenant, the one that drives the footprint to these establishment, is the one that actually realizes the value of the whole mall. So usually these are supermarkets, and when you look at football, really it kind of serves the same purpose when it comes to the larger sports ecosystem and even just Africa's social and economic markets, because it has the highest participation rates across all age groups. It drives the highest media attention. It has the strongest international connectivity. If especially look at something like the transfer market, footballers are the ones that are migrating in huge numbers. And then especially for us in Africa, it deepest emotional cultural resonance across ethnic and national boundaries. You all know what football does to us when we congregate in stadiums or even in sports facilities at the grassroots level. It really helps to drive connection, and it's something that resonates with almost everybody across the continent. As one of my mentors says, David Goldblatt, football is actually the cultural mirror of our society. So a lot of what we observe in football, you will probably observe the same in broader society. So this is just an illustration of the football as infrastructure model, just seeing some of the areas where it can have a direct impact and why we need to invest with these models. So we are looking at how it affects investment, changing from the traditional sponsorship and charity models to private public-private partnerships. Another thing that we really need to think critically about is how do we unlock more domestic capital now that foreign direct assistance is drying up. Then of course football drives social cohesion. It drives education. A lot of research has been done around retention of students in schools as driven by sports. We have also seen a lot of scholarship opportunities being unlocked through football and sports in general. We have employment, both direct and indirect. If we are to invest well in football, then the jobs that will be created or that are already there, for example, coaches, just helping to make those quality jobs should be a primary, motivator for government, for example. And of course, now there is innovation. We have seen a lot around, performance technology, platform technologies for fan engagement. So football in itself, sports in it drives innovation. And for the sake of our webinar here today, health is our focus. Though I mentioned it last. So how can we use, for example, football as touch points for various health services, be it screenings, providing care, maternal and otherwise. Football also is known, of course, for its benefits physically and mentally. But the question now, are we investing in football to realize these gains? And do we actually measure or get the metrics for doing this? So at the Football Foundation for Africa, and those who have been interacting with us at least for the last 4 or 5 years, you're aware that we have the Africa Football for Development Network. So these platforms that brings together grassroots football communities across the continent, that's academies and clubs. And this for us is the delivery platform for our football as infrastructure model. And probably the numbers should be updated here. I think when we were preparing these slides, we were at around just over 50 clubs and academies across East and Central Africa. But we recently are revamping the platform, and we have close to 150 registered clubs and academies and sports organizations that are using football in one way or the other to drive different social outcomes. And here is when you start to realize really what the benefits that we can be driven when we start to measure these outcomes and be able to present the same to potential investors. So, for example, the reach you can get by through football, and that's the touch points for community. You can say every club or academy might have 50 to 70 staff and players, but these players come from families, they come from a community, so that grows exponentially when you're looking at community reach. And currently we are designing a couple of pilots in Kenya and Ghana, where we have also South Africa should be coming into play. And the idea here is to start demonstrating how football as infrastructure really works. So looking at facilities as hubs as opposed to just football pitches. What else can they do? And then using technology that is now available for us. How can we run real-time adaptive programming that is again data driven? Data becomes the new oil, as everybody's talk about. So how do we make sure that this is captured? And that is what our Africa Football Development Network. You notice we've dropped the 4 from the naming, and this is very intentional because we don't say roads for development, we talk about road development, and that's why we're saying Africa Football Development Network. It's no longer African Football for Development Network. So really realizing that football is infrastructure and needs to be treated as such. So yeah, to our conversation today, and I'm sure the panelists, our able panelists, will go deeper into this issue of women's health and how we can really leverage football to drive the whole agenda around women's health. For me, it was a realization that the amount of research that is going into women's health is really negligible as I was preparing these presentations. So really, how can we boost this using our football as infrastructure model and working with an organization like Policy Strategy Group to make sure that we position this conversation in the right spaces so that we are driving gains in both sectors, in women's health and in football. I know in probably 2016, when FIFA published their FIFA Forward 2.0, they talked about investing 8 million USD in federations specifically targeting women's football. I think we need to go back to that, see how far have they come and what were the outcomes, because I think if they had invested with a model like football as infrastructure and focusing on women's health, it would have definitely even driven or expanded the partnership outreach, because we need to get new players or new investors into the football space. And when you talk about women's football, their products, services, organizations that are really keen on women in general. So how do we bring them into the football space to drive both football or sporting and health outcomes for women? So this is what really we'll be looking at or engaging in this webinar. And like we said, these are things that are already happening. For example, this case study in Western Kenya, with a sample size of about 700, where they were able to, realize that organized soccer reported significantly higher odds of good or excellent health in women, um, reduced pain, fatigue, stress, and also medication dependency. But the question now for us is, how do we scale this kind of initiative as opposed to just having it as a one-off program? And as I alluded to earlier in the presentation, there's also an opportunity to tap into non-traditional funding streams like the Gates Foundation, who are now focusing on women's health. So our football as infrastructure model is really an innovation that can, speak to this kind of organization or philanthropy that are keen on investing in Africa to drive, social and economic gains. So with our model, and in this case for women's football, we look at it in two ways. One is football as delivery infrastructure. So what do tournaments, clubs already deliver? Events like we're going to have AFCON, and how do we use those to drive different agenda, in this case women's health? And then something interesting that my colleague Lindi Ngwenya will speak to a lot is the solidarity mechanism that actually brought FFA and PSG together, seeing how benefits can be shared equitably across ecosystems globally to make sure sustainable and equitable funding across ecosystems. So this point really is to hand back to Tshiamo. Thank you very much for your audience, and happy to take questions as they come, and at the end of this webinar. Thank you very much, Tshiamo.
Thank you. Thank you very much, Brian. Much appreciated. And I think you've really just framed how football is not just a sport or recreation. And in the same breath, infrastructure is not just built with physical structures, but, networks, community, policies, and the like. Maybe I'd just like to take a little step back. You obviously mentioned that some of these models and frameworks are really critical looking at the African region, which is obviously dear to all of us here today. And I think there's obviously many countries in our continent and many ways of doing things, and obviously how we also lean on the global governing bodies when it comes to football. Maybe if I can just ask, how do you think that our countries or regions on the continent can start to share more, have more transparency, and maybe a centralization of learnings? Because there's many people and many initiatives going on, and of course, these ideas and models that we're speaking to today. But how do we sort of have an easy way to be able to learn and leverage on each other's learnings, and communicate with each other, so that we're not operating in silos when it comes to such developmental issues and frameworks as you've discussed?
I think we are already doing that. So this kind of platform, for example, is very much open to people across the continent, and this is where we share what we have been doing, and some of these ideas. And we have to also realize they are not perfect, so we need all the stakeholders to really be part of these kind of platforms to share their ideas, knowledge, in order to drive the agenda forward. So this is all of course a good start, just putting the knowledge out there for it to be to be challenged. And at the Football Foundation for Africa, for those who are aware, we also organize the Africa Football Business Summit. So again, another platform where people can come together, exchange knowledge, and even more important, start to develop projects. And we have already seen some of these outcomes happening. But something that is really critical, and this is what now Africa Football Development Network speaks to, is the need to develop infrastructure to start sharing data and knowledge, information across the continent, because by nature of what sports is, we are always almost reduced to competing with each other. But we need to develop a layer that is, I don't want to say above or below, I'm not sure which, but a layer where there is more cooperation than competition. I think that is very critical going forward, and with the help of technology, I think we should be able to share data and knowledge. So what are academies, for example, in Kenya doing that, academies in Ghana could borrow? What's already working in South Africa that could be implemented in Egypt, and similar kind of, arrangements. So competition is good. Competition is good for improvement, but cooperation is also equally important. And it's by creating these kind of platforms that we'll be able to realize this, Tshiamo.
Thank you, Brian. And I think you've honed in on something I want to touch on then, cooperation being important. And I think that also stems across industries, not necessarily just regions and countries, but speaking to football as infrastructure for health, that's two completely different sectors that we're trying to show can cooperate and collaborate. Maybe I'm going to go to you, Spring, looking at systems and policies and the like. Why do women's health and football belong in the same conversation?
Well, I mean, I think Brian, well, first of all, thank you very much, Tshiamo and Brian, for the collaboration between the Football Foundation for Africa and the Policy Strategy Group, which we think is critical. The beautiful game belongs to us all, and health as well. Let me also join everyone in wishing all of us wonderful International Women's Health Month. Having said that, I think there are 2 points, 2 touch points that I would like to focus on. The very first takes us back to the COVID pandemic. And as you will recall, during the COVID pandemic, when systems for governance and for delivery of health collapsed, the first thing that the political level realized was needed was solidarity in order to ensure that everybody profits from something that we considered a good for us all. And historically in football, the kinds of investments that have been made and the kind of structure, the infrastructure that has been set up in football has also addressed this question of solidarity, right? But why is it that we all should care about this thing that we are trying to achieve? And while Brian has outlined some of the key characteristics of infrastructure, one of the things that I observe is that robust infrastructure needs to be sustainable, self-nourishing, and self-interested. And that applies equally to health as it does to football. Good infrastructure does not depend on perpetual external subsidy. It generates returns that sustain it. And it attracts investment, as Brian said at the top of his presentation, not out of charity, but out of rational interest. So the system feeds itself, right? The other thing that robust infrastructure does is that it survives political volatility, or you can even think about other challenges, risk challenges to the infrastructure. Infrastructure endures because it is embedded, not because it is favored. And so for women's health, as for women's football development, what we want to see is that it is embedded in the infrastructure, and not that it is favored or out of favor in one moment or another. As Brian brought up on his last slide, there's very little investment in global health research and development that applies to issues that affect women exclusively or predominantly, and not just when they are footballers, but throughout the life course, right? And so from the point that they are young. So where are we now? We're at a point where investment in health, particularly in and for Africa, is facing a convergence of crises. We've seen the multilateral system collapse. It will arise again, maybe not in the same form as it exists now, but the existing architecture that sustained decades of progress, so such things as a Global Fund, or Gavi, or WHO core funding, these are under unprecedented pressure, right? And at such a moment, what we want to see is replenishment, commitment to the mandates that have been set, and commitment to that post-pandemic consensus that we need solidarity and we need collective health security. And what is looking to come in its place is a transactional extractive bilateralism, where a stronger party will take that which it needs in order to meet its own interests, and the weaker party, in this case, in health, as previously historically was in football, will be extracted and will, if you like, lose. So it's tied to geopolitical leverage, resource extraction, or migration control. And actually, why we're so interested in this collaboration is because we see there's very strong parallels to what happened in football, and why FIFA took the decision to establish a solidarity mechanism. And it's a mechanism that works very well. So Brian has talked a little bit about what football as infrastructure can attain for all of us. But if you look at the internal logic of the football infrastructure itself, that too is a model which can be extended and applied to both women's football and to women's health. What is that? The benefit sharing architecture of FIFA has two primary mechanisms, and they embody all of the infrastructure principles that Brian has talked about. The first is what is called training compensation. For those of you who are coming to this from football, you know this. For those of you who are coming to this from health, let me just give you a very abbreviated description of what that is. So when a young player, male player, signs their first professional contract or transfers between clubs before the age of 23, their new club pays compensation to every club that trained them from age 12 onwards. So to everyone who was involved in their development. The system is managed by FIFA, and it's automated, standardized by category, and is enforced globally through FIFA, through the FIFA clearinghouse. That ensures that grassroots clubs, who are the ones who do all of the unglamorous high-risk work, the long horizon of youth development, they are rewarded when that investment produces results. The second arm is the solidarity payments, as they are called. When a player under contract transfers between clubs in different FIFA jurisdictions, up to 5% of the transfer fee is distributed to all clubs involved in the player's training and education between the ages of 12 and 23. Unlike training compensation, solidarity payments continue throughout a player's entire professional career every time they've transferred. So this creates a cumulative, perpetual, self-sustaining system that raises the baseline, is self-nourishing, is enforceable, and is enforced, right? So for all of us, that means that let's take some very famous African names. Let's take a Sadio Mane. If Sadio Mane transferred from club to club until the age of 45, continues to play football, everyone continues to benefit from that, from the small club that trained him in Senegal at the outset to the last club that he ends up in. And I think that this presents a really strong model that we can look to apply for investment in all of the other areas of infrastructure that we think are also needed to support football itself, because we need people to be healthy, to be footballers. We also need to invest in all kinds of innovation that apply to making our footballers the perfect person, right? So a female footballer needs investment that looks at what happens to her joints when she's on her period, what happens to the way she plays, what happens if she can't have her period, what happens if she's injured in other ways. All of these things are innovative investments that could be made broadly, drawing from the world of football, but not only relevant to the world of football. A second very short observation, and then I'll stop and hand back to you, is if we look at the virtuous cycle that is created through this solidarity mechanism in men's football, what we see is that male footballers themselves, where do they reinvest? In health, in sport infrastructure, in their home communities, there are countless hospitals, clinics, football academies, schools, clean water systems that are invested materially and sustainably, in some cases, by male footballers themselves, because they have the resources to reinvest. It's not philanthropy as we know it classically in the Western sense, but it is direct capital deployment into social infrastructure, often in communities that would otherwise not have access. Let me stop there. I'll talk about some of the gaps that there are in women's health a little bit later, because the solidarity system doesn't quite work for women's football yet.
Thank you, Spring. I think perfect time to hand over to Lindi. Obviously, Spring has given some background into some of these mechanisms for those of us who don't know how they work and how they aim at ensuring that value flows back to those who develop talent. Lindi, maybe just in your experience, have you observed, or is there any sort of evidence or research in ways how this has worked, and maybe more so how it hasn't worked? And I think Spring mentioned the gaps in women's football, and why do we think those gaps exist when it comes to these payment and redistribution mechanisms, particularly in women's football?
Yeah, absolutely. Thank you very much, Spring, for describing so eloquently the FIFA system for compensation. I think, look, the core of the system, the reason why FIFA implemented this system was actually 25 years ago. Because up until then, the way things worked with clubs was that when a player was out of contract, essentially, then the player was not free to move. The club could still extract effectively a fee from an engaging club who wanted to sign the player. When the Bosman ruling, which was a legal ruling, essentially blew that all away, FIFA, obviously prompted by the clubs, realized that if they didn't implement a system that rewarded training and development clubs, then the whole system would fundamentally collapse. There has to be something in place to reward those actors at essentially the bottom of the food chain, pardon the phrase, who may not receive direct money, but obviously their contribution to the food chain is absolutely essential in order to keep the ecosystem sustainable and producing the players. So that obviously caused the implementation of the compensation system in football. Now, when we kind of look at, I'll touch on why this system hasn't been involved in women's football, and then I'll sort of go back a little bit and talk about, I guess, from my experience working in the football industry for the last 13 years, how it works well and where it works not so well. So women's football has obviously had its own historical challenges. The biggest challenges for women's football was that up until, sort of about 40 years ago in the 70s, it was banned. It was effectively, football was essentially labelled a men's sport, and there was no real access for women's football into that particular arena. As a legacy of that, it's only really been in the last sort of 20 years, realistically, that you have seen the gradual professionalisation of the women's game. Now, I use that word professionalisation very, very intentionally, because without the professionalisation and consequently the wealth generation, there isn't really then the fuel, so to speak, to have a wealth redistribution system. So the reason why that system has been in place in men's football is because we've had men's professional football for many, many decades. And therefore, there is wealth within the system. And that system essentially was put in place to redistribute the wealth to the training clubs. Now, I actually posted something on LinkedIn about a week ago about women's football. I do actually think the time is right now, which also really kind of ties in very well with these conversations that we're having, to implement a solidarity system into women's football. The wealth within the women's game is growing. And again, you see the sort of different stages and different speeds and the disparity of that wealth generation in the women's game. And actually, if we can then implement a system that is similar in characteristics to the solidarity system in men's football, then we can redistribute some of that wealth and again help to make this a sustainable system that we can continue to use to grow the game. So what are the bits I think that work well in the FIFA system that can inform us in terms of how we might implement this across women's football, but also more broadly across other sectors such as health. The main thing really is around this idea of having a series of recognizing the value of those sort of education clubs in the ecosystem. But in order to do that, you have to identify them. So one of the big tenets of the FIFA system is you have tracking. Yeah, so within FIFA, you have 211 international associations, and they're split up across the 6 continental confederations. Each of those member associations, when a player reaches the age of 12, those players are meant to be registered within each international association, registered in the system. So therefore, from the age of 12, a football player is trackable. So that as their career then evolves, and we're then going into, you know, their career evolves further, and we go into a situation that maybe they might become a professional player, then a player passport can be produced that can provide the data to the player's education and the data from the age of 12 all the way through till 21, when this solidarity mechanism is in place. So FIFA have a system in place called a transfer matching system that essentially pulls all the data from the different national associations and is able to then produce the player passport that is consequently used to calculate the training compensation as well as the solidarity. So the systems that are in place by FIFA are good and have actually helped to ensure that these training funds are distributed to the correct clubs, and it happens in a relatively timely manner. And actually, as the technology has evolved, those systems are getting gradually more and more efficient and quicker. Because when the system first started, it did take quite a long time from when a player maybe was signed professionally to actually the training clubs to receive that benefit in terms of financial compensation. The other thing that's good about the system is because there is that trackability, that traceability, and with FIFA as a governing body, you have a means of redress through things such as the Dispute Resolution Council, then there is enough of a robust governance framework, I think, to give training clubs the confidence that if they do invest in the players, and they therefore are, you know, they have their rightful dues if those players become professional, they are able to essentially reap those rewards. And if there's any reason for whatever that someone decides to try to strip them of those particular benefits, they have the recourse at FIFA, at the DRC, the Dispute Resolution Chamber, to actually get their rightful reward. So it's important to have the infrastructure in place with regards to the data and the collection and the tracking, but it's also really important to have the governance framework, and FIFA have been quite good in both of those respects. Where the so those are the sort of good points, and like I said, there's some real examples of African institutions who've really benefited from the system. They regularly produce players and develop players. Those players go on to play in, you know, professional football, whether it's in Africa or around the world, generating big transfer fees, and they benefit with regards to solidarity contributions on all of the other mechanisms that FIFA have in place. Where it doesn't work so well is, like anything, any system is really a function of its weakest link. And if to be completely honest, the weakest links tend to generally be down at the national association level. Because if we take it back to the actual tracking of the players, the registration of the players when they're 12, the subsequent registration of the players as they continue to progress through their academy career before they become professional, a lot of that is quite administratively heavy at the national association level. In terms of, you know, in any country, you will have thousands of grassroots clubs, right? And at the end of the day, the system is only good as the documentation and all the tracking that's implemented in there. So what you've tended to find, and unfortunately Africa is a lot of countries in Africa, a perfect illustration of this, is that you've had players whose history or their playing history is incomplete. It hasn't been documented properly in the system. And when that player then subsequently is transferred or signs their first professional contract, you get a whole range of competing clubs and academies claiming to have developed that player. And the whole thing gets snarled up in lots of disputes and essentially very, very difficult and a big administrative burden, both at FIFA, but obviously for the national associations. And ultimately what it means is that, you know, the training clubs, maybe the rightful training clubs in a lot of instances, are not receiving the right amount of compensation for their efforts. So there is an issue here of actually making this system robust at the weakest point. And that is something that you need to consider. And when you sort of roll it out then into something as broad-based and wide-ranging as health, I think that probably even multiplies that potential issue. Okay. And then really I wanted to kind of take things back to the women's football. And I would say that my observations from working in football generally, not just women's football, for the last 13 years, is that football has not necessarily been the most accessible and the most inclusive for women, right? And if we are going to use football as infrastructure and as a platform to help to develop along many other sectors, we also need to address that core issue, because if I look at like the distribution of funds in football, for instance, across Africa, you can talk to many women's football program staff where there is a number that's allocated to the women's football, but what they actually see is probably far different from that number, and where that money goes to tends to be on what I call sort of trophy seeking, sort of shiny type projects, paying for their preparation for the men's team for AFCON, or all of these other leakage points. So if we're going to have this system implemented, it has to be something that we can make sure, or we can really ensure does benefit the women's side of the equation, as well as the overall benefits that it can bring, across the board. So yeah, that's really my sort of observations and I guess my recommendations.
Well, thank you, Lindi. I think you've given us quite a comprehensive insight into the system, what's worked, what hasn't worked, and I guess the opportunity for applying a similar model to the health sector. I'm going to come to you, Dr. Divine Cophie in Ghana. Obviously, Lindi spoke a lot to things of data and research and being able to monitor some of these initiatives. And given your the world you live in terms of academia, I anticipate, and obviously in health as well and science, that those standards and testing and research is very important. How do you think we can now, one, looking at what are the most pressing health challenges that are facing women and young girls on the African continent, and particularly in our communities, and how can we now integrate scientific research and systems to try and address these? And maybe you're looking at sport-based interventions. Of course, we mentioned football, but as Brian said earlier, there's many other sports. But how do we sort of marry these two to address some of these health challenges that women and girls face?
Thank you very much, Tshiamo, and thank you for having me. I believe that the University of Health and Life Sciences being partnered in this program, and myself coming in as a man, is more indicative of the solidarity that we are giving to women football. And I believe that all of us are excited that we are looking at this. First, I must say that football as a sport provides numerous benefits, and for women provides so much benefit. But I must also indicate that just like Brian said at the beginning, about less than 1% of funds go into research on women's sports, and that also applies to Ghana. So we have done some research for my school of sports and exercise medicine, some research on sports and its effect on cardiorespiratory endurance, on a number of factors. But one thing that we have not really done much on is women. But then, of course, we understand what the evidence tilts towards. So we know that exercise or sports as exercise pattern among women helps to be able to improve their cardiometabolic parameters, so their BMI, and therefore improving their cardiorespiratory strength as women, and also improving their self-image. And we understand that sports also, football in this case, and for women, it's able to improve certain hormones that helps them to live better, or to be able to reduce stress and anxiety among women. So we come to understand that women football, it's not just a sport where people are just competing, but it's also providing some very good ground for their health outcomes. As I said earlier, because we have not done a lot of evaluation, a lot of assessment on the outcomes of all these things. I mean, if you go online to search for papers that have been done to evaluate health outcomes of women in football, you don't find much as you may find in men. And that also brings the call that there must be a lot of work to be done in this area to be able to improve the outcomes and therefore tell the story very well that these are the outcomes that we have as a result of women's football. And as you were saying, looking at the challenges women face, women face a number of challenges in football. We're looking at incidents of iron deficiency anemia. Sometimes when some researchers say that when with the movement of the feet on ground and all that, it introduced something we call foot strike hemolysis, leading to incidents of iron deficiency anemia, and how much the athletes also eat also influences that. And when what they are even eating as athletes or footballers doesn't balance what the energy they are spending out, there's what we also call the relative energy deficiency in sports, where women are expending more energy than they are taking in. And those are challenges that come with sports. And we also understand that there are certain sports, and football not exempted, where body image issues come in, because when people are in certain sports, they expect to have certain body sizes. And so when they don't have those body sizes, they may be playing very well, but because of those issues, it brings body image issues, which can also affect their self-esteem and also even affect their performance ultimately. And these body image issues also, one way or the other, could lead to eating disorders. So when somebody feels that, okay, I'm supposed to be this particular size to be able to play very well in football, and I'm not that size, then let me do something to myself. Let me stop eating. Let me not take this particular food on my own without consultation to the experts. So women sometimes get into some of these things and then create what you call the eating disorders, like anorexia and athletical anorexia nervosa, bulimia nervosa, among other things, which are serious things that affect women. And this would also lead to stress and anxiety. So these are key challenges that sometimes also affect women, despite the benefits that women football provide the women in sport. But you ask what are the systems that can be put in place. But adding that, I would say that besides all these things that we have mentioned, football as infrastructure creates a system that delivers good health to women. And what do I mean by that? So normally in public health education, we bring people together, community engagement, like debates and all that. And in bringing these people together, we try to educate them on one program or the other. But women football, as we are very much aware, normally football, we are looking at men. But when women engage themselves in football, it brings the community together. So health programs are able to get delivered to the people without having to create extra debates to be able to bring this community together. So in Ghana and in some other countries, as I've read, we have community football bringing women together for the initiation of vaccination programs. So they're able to do certain vaccination programs like the HPV vaccination, the human papilloma virus vaccination, through some of these women-led programs. So the women gather together for football games, and then the public health experts use that football as a system, as a delivery system, to be able to, provide that service. Also, this sanitary pad, women menstrual health issues. There are some non-governmental organizations that also help to be able to distribute sanitary pads. And in Ghana, as I speak now, there's a system that the government is using to distribute sanitary pads to help the women health issues in secondary schools and the junior high schools. And football also is also a delivery system where people gather together, young women that are hard to reach in communities that is very difficult to get them. Probably they are not going to school and all that. Football serves like that infrastructure that brings them together. And then some of these interventions are also delivered to them. So football is providing health benefits, improving their cardiorespiratory endurance of athletes. It also improving their bone strength, because there's enough studies to show that as when people play football or they exercise, it improves their bone strength. And also for women, it reduces the risk of osteoporosis in later life. So women that are engaged in football most likely are having a reduced risk of osteoporosis in later life as compared to people who may not be involved in exercises such as football. So beyond all these things too, there are policies that we can also integrate. I mean, to be able to help prevent or manage certain conditions like non-communicable diseases through women-led football. So this public health policies, as I talk about, we can use women football to bring that engagement to the doorstep of communities. So communities where they probably do not have so many young girls probably going to school, it can bring the public health aspect to that community through football because it brings the people together. And in that case, we're able to educate. One other thing is women football brings that peer-to-peer discussion amongst themselves. So if there's any information they can discuss, if there are things that stigmatize women, like menstrual health issues that sometimes become a stigma among women, through women football, there's that peer-to-peer engagement and discussion. And so they're able to build their self-confidence and then reduce some of these stigmatization issues. Also, the coaches in women football, if they are well educated, because most of these people listen to their coaches, they are interacting with their coaches. So the coaches are well educated, it becomes a platform to be able to educate women in some of these public health programs and all that. And it helps holistically to improve the well-being of women. Now, you mentioned being able to look at certain systems that also be able to help our women generally. And I say that there should be that conscious effort by people in academia, by people in governments, and people like Football Federation for Africa, and just like we are doing, and the policy analyst group, all these people coming together to be able to make that conscious campaign that football can serve as a delivery system for health programs to protect women, to improve women's health, to improve women menstrual health, to improve cardiorespiratory health of women, to improve reduce risk of non-communicable disease like diabetes, hypertension, gestational diabetes, and all that. So what do? We make sure we implement these strategies or we incorporate these strategies into women in football so that at the end of the day, we are not just looking at football as a sport, but also as a system to be able to deliver certain health systems to be able to help the people. So I would probably leave it here. I don't know if maybe I would want to add some policies that could also be implemented or how the youth or the adolescents could also be involved, because all these things we are talking about adolescents being involved or the youth being involved. And a number of times we are looking at the human or the youth just being the end users. So they are just recipients of some of this intervention. But I believe that beyond just being recipients, we can also make them stakeholders, being involved in drafting some of these delivery systems, bringing them in the data collection, in the design of research. So that they are not just recipients of the systems, but they're also part of the agents that are delivering those systems. And then also, for me in academia, it's important that we start training our students. These things are also embedded. I know that some of these courses are embedded in the students' training so that when they get out there, they are able to grant that education for people to understand that women football and football in general, it's not only a sport, but it's also an infrastructure that is delivering health to our women. And also finally, at the community levels, we have people engaging them so that they'll be able to work together with policymakers and they work together with NGOs, work together with organizations like what we are doing to be able to implement some of these things and ultimately help to improve women's health through football as infrastructure. Thank you very much.
Thank you. Thank you very much, Dr. Divine. Before I come into the policy, we do have some questions from the audience, and maybe I'm going to look to you, Spring. And I think this sort of leans on how do we get our policymakers or decision makers to also be involved in this conversation and collaboration. But the question we have from Nyara Amankwa, forgive me if I pronounce it incorrectly, when football is positioned as a health delivery platform, where does the legal liability sit if outcomes fall below medical standards? Spring, I'm not sure if you're able to answer this, or any of my panelists, please feel free.
Thanks. If I understand the question correctly, they're thinking about health services being delivered at the point at which football is played. So you have a grassroots football tournament, and you provide a number of services. I mean, I think typically wherever health services are delivered, there's quite a lot of regulation, right? So it isn't that you can just rock up to this grassroots festival with your medicines and syringes and so on, and do which it is you wish to do. At the entry into any country, health products are heavily regulated, and no program that asserts itself as delivering health services escapes the scrutiny of the health regulator. So I think there are some protections in place. Obviously, those are only as good as the regulators are strong. I think Lindi pointed to other questions where there are, if the regulation is weak, then the system fails, and that would be the same. So the liability will always rest with the organizer of such events, etc., or such services that are being provided through football. And typically there would be instruments in place to ensure that there is insurance, both liability insurance and also health insurance. So I hope that answers that question. More broadly about policy, I think that question, how do we get policymakers interested? I mean, I don't know anyone who isn't interested in football, right? Whole countries shut down during the World Cup or during our AFCON or whatever. Our presidents say things and so on. So there is a strategic advantage that football has that very few other sports or other enterprises have to attract attention from policy and policymakers. One of the things that we can do to interest them is really socialize the models that are used that have worked well. Again, Lindi and Brian, in different ways, have elaborated what it means to have infrastructure that is good, that is robust, that works, and that brings you benefit. In the same way that we see investments from private actors themselves involved in sports back into their sports, we see, for example, American footballers buying into English football clubs because of the interest in both the self-sustaining and the potential to generate wealth from those systems. We can transmit those messages to our policymakers. And I think there's some countries that started that work. If you look at what the Gulf countries started to do, they very deliberately started to use sport as infrastructure and took that up to the policy and the political level, right? It's not about just the football, it's about everything that it brings with it. It's not just about the gains that we will make today with one football club. It's that if this football club establishes a brand and a legacy, that is something we can profit from in perpetuity. So I don't think that's a very difficult argument to make. I don't think it's one we've spent enough time making on the African continent.
Thank you. Thank you so much, Spring. We have another question from Nomvula Lubisi. Hello, Nomvula. And maybe I'm going to pose this to Brian. I think Divine might have touched on it, but how can partnerships between football organizations and health providers really be built to improve women's health outcomes, both at a local level and a regional level? And if there are any examples that you can share, my panelists, please feel free.
Thanks, Tshiamo. I think from the presentation we already had, the example from Western Kenya, where they are able to demonstrate, the positive outcomes of getting women involved in organized soccer for a duration of time. So, in my view, it's just about reinforcing and scaling these partnerships. For example, when we're organizing grassroots football tournaments, or when we're organizing grassroots football leagues, which are taking a longer duration, looking into the ecosystem and trying to identify which players within the health sector could actually provide their services to the women's game, and designing our events in such a way that they help players can, almost seamlessly plug in to the football ecosystem, and this again opens up another conversation that I believe in is very important, because what we know, and Lindi has alluded to this, women's football is still struggling to attract financing. So when we are thinking of partnering with organizations from the health sector and delivering these services directly to where these women are, there are also organizations, companies that can come in as sponsors, and in this case we are looking at, for example, insurance companies. When you're talking about health, all of a sudden they have an interest, or a bigger interest in the football space. So we really have to be very innovative around how we position ourselves, or the value proposition that we are offering potential funders, sponsors of a football ecosystem. And I believe this is where these partnerships will really work well. I remember in 2020, we tried to do this in one of our tournaments, Obama Cup 2020, and we brought in Benacare Health Services, one of the health startups that has since grown tremendously into the space. And it was just them providing basic services such as screening for blood pressure and some diseases. And you'd be surprised at the amount of data that we're able to collect in just one day, and that how can now inform our approach to potential finances, sponsors of football. So I think this is where there's a huge opportunity to push this football as health infrastructure for women's football, as opposed to just let's get more women playing. Here in Kenya, we also have moving the goalposts, which has been running for quite some time under Dorcas Amakobe. I really a shining example when it comes to developing women's football. And for us, it's now to provide a platform where these, if not the project itself, its model can be scaled through Africa Football Development Network across the continent, across the region. We are now engaging with a new club in Ghana, or something that is being fashioned in Ghana, and that's the Kona Women's Football Club. And it will be interesting to see how they set up, because they are starting. And this again is an opportunity, as my friend Divine points out, to bring in academia, so that from the onset we have set certain baselines that we are going to measure certain outcomes, what are really developing, as opposed to just football itself, so that we can expand who we are able to reach, and what we are able to tell them about the value that we are creating within this football ecosystem, and in this case in women's football.
Thank you, Brian. Just in the interest of time, we'll maybe take one or two more questions. The next question, I'm maybe going to pose it to Lindi from our participants. I'm not sure who it's from, but it says, what is envisioned as the application of the solidarity mechanism when it comes to health governance? Is this purely about investing the proceeds, or mirroring the model, or both? And yeah, I'll look to Lindi and Spring. Please feel free to jump in as well.
Yeah, thank you. Well, I'll probably stay off the territory of the health governance aspect, because I'm very much obviously coming from the football side. But in terms of addressing the question of whether you mirror it or you invest the proceeds, I think it's about, like I said earlier, it's about taking some of the elements of the football compensation mechanism, the good elements of it, and being able to fit it in a framework that makes sense for the health sector. In football specifically, there is a financial compensation aspect. That is fundamentally what drives the system. It's the fuel that helps these training clubs to then be sustainable. But I am very, very aware that obviously in the health sector, it's not always going to be, the benefits aren't clearly always financial. And so there must be a way to obviously, I guess, define what the benefits are, make it a little bit broader, because things like data sharing are absolutely crucial, I'm sure, in the health system, particularly when it's around, sort of pandemic response and other aspects. That's not necessarily a instantly attributable financial benefit. However, that benefit absolutely has a tangible thing, and it's something that should be encouraged. So I think it's more about understanding the sort of the positive aspects of the football system, really seeing how you can frame it to work in a health system, and also being able to widen the sort of definition of benefits beyond just the sort of the financial aspects, which is what we have in football at the moment.
Yeah, I think I'll keep it brief because I think Lindi has actually said it. It isn't about, first of all, it's not about taking the proceeds from football and investing them in health. Definitely not, because Brian said this earlier. We don't want another model where you're just, it's a question of being in favor, or it's sports for development. And then when we lose interest, off you go, and there is no investment for you. And broadly, it's about taking what works in football or looking at how it can be translated and applied for health. Let's just use the data example in a little bit more detail to illustrate that. Supposing there are a bunch of African scientists, as was in the case in the pandemic, that are involved in identifying either viruses or solutions that might be relevant for managing a pandemic, right? And they have the data that sits with them. They don't have the capacity to take that and translate it into a countermeasure against a pandemic, a medicine, a vaccine, a diagnostic, right? But they have made a meaningful contribution to the science that would result in the delivery of that end-line technology. Now, if you take the FIFA model and you apply it to that, if you take the solidarity mechanism, you say, hey, a medicine is made, people make loads of money out of it. Some of that profit should go back to those who were involved right at the beginning of the process, those scientists who help us to identify either what the problem was or what a potential solution was. They constitute, if you like, not a perfect, but the grassroots, right? And so from the grassroots all the way to the grass tops, everybody benefits. So it's about application of the model, and that won't work perfectly. The other part where you can apply the model is in terms of the governance and tracing back who should get what. And there are systems already in health for tracing around, especially diseases of pandemic potential and around sequences and samples. So that could be married and tweaked with something that comes from FIFA, this FIFA solidarity mechanism. I'll stop there.
Thank you, Spring. Thank you, Lindi. I think we're going to close with one last question, but we'll see how far we get and open it to all panelists. And I think we might have touched on this, but where do you see the most critical regulatory gaps in leveraging sport as a public health tool, particularly for women in Africa? And maybe leading on from that is who is missing in this conversation, or do you feel that anyone is missing?
Okay, so maybe I'll speak. I'll say something in regards to the policy, but somebody asked a question whether who takes the blame or if there are any gaps. So one thing you must understand, if you want to, especially for this public health space, you want to deliver certain health systems at using football as infrastructure, you must understand that whatever you are delivering is standard. It's not something that you just wake up one day you want to go and deliver. So people in Ghana, there is this program we call Girls Iron Folate Tablet Supplement. So normally is a supplementation program that is carried out in schools. So with this discussion, this is something we can use football as infrastructure to be able to deliver this supplementation program to people in the community through football engagements. So if you are bringing such a program on board, then it's a program that is already accepted nationally. So you are just diverting it and using football as infrastructure to be able to bring this delivery to the people. So in such a case, it's already standardized. However, if you want to, maybe it's a research and you want to gather some information, you want to understand how things are done, In academia or in research, you will have to get ethical clearance, meaning that you would have indicated the processes that you are going to use to be able to gather your data, whatever systems you are going to deliver over there. And it has been reviewed by a very legitimate and regulatory body. And so whatever you are going to give out is being checked out to be sure that it would not create a problem. However, when there's a problem, you also indicate that there's a certain level of liability on the person doing the research, meaning that you would have done all your works very well. The regulatory body should have checked to be sure that everything you are going to do is standard, and most likely there's not going to be any problem. And in that case, you can easily deliver. But again, as I said, the other side is programs that are already being implemented. You are only using football as infrastructure, so sanitary part or vaccination programs, you are bringing the health experts. You are not just going there if you are not a health expert. You are bringing the public health experts who are already doing the vaccination programs in other places. You are using football as infrastructure, bringing them together, and then they will deliver some of these tools. In that instance, you, the person bringing them together, you will not have liability, but the system is the one that is providing that kind of system. That's what I would say on that. But who is not on the table? I probably think that academia were on the table, NGO, FFA is on the table. Probably critical policymakers should be brought in, and other NGOs. I know that in Ghana, there are a number of NGOs that are trying to push this agenda in one way or the other. But I believe that the politicians who make the rules and all that should be brought seriously on the table for them to appreciate what football is being used as infrastructure to deliver. And then I believe that when they are making policies or making laws, they'll be able to consider this and then put the right systems in place to enhance some of these implementations. Thank you.
Just if I can add on to that, Tshiamo, and just to reinforce Divine's comment, I think with the football as infrastructure, and this is something probably we'll unpack a bit more in terms of who plays what role, government becomes really central in delivering, especially now when we're connecting to issues of public health, of education. And this is right from national, regional, to local level government. How do we sensitize, in this case, policy makers and implementers within our government to understand what the football as infrastructure model can develop? As again, we have had there isolated programs happening in different places, but how do we systemize this so that it's happening across academies? It means there has to be an element of regulation and support, even to think about what constitutes a club or an academy, and that has to come from our national sports policies, but also feeding into or plugging into other policies such as health, education, so that we have these what we call interministerial arrangements that are working. Because even as Spring has said, really football excites everybody. Everybody becomes interested all of a sudden, but the conversation is really always almost limited to competitions and event hosting, especially when it comes to our governments. But when it comes to the development of football, the development level, you find our academies and clubs have really been left on their own, despite the potential for them to develop outcomes that are important for the national outlook of our countries and the continent. So I think government is a key player, and even as we progress, it's important that we bring in government players to have a discussion around what we're trying to deliver with football.
Thank you, Brian, for those closing remarks. And yeah, I think that brings us to the end of our webinar, although we could definitely go on. So apologies to those who have posted some further questions. Hopefully we'll see if we can answer them on our platforms. But yeah, I just want to say a big thank you to our panelists, obviously our hosts, and to all of our participants who are here today. I think we've had a very thought-provoking conversation and really given us some things to take home, whether health is infrastructure and should we be building it where people already exist and already gather. And if women's health particularly is foundational, then it needs to be intentionally funded, designed, and delivered. And we've seen that there's an opportunity to that through such structures at football, which is one of the most powerful systems on the continent, as you've heard today from my fellow panelists. So thank you to you all. We will definitely, this is the start of our series of webinars looking at football as infrastructure, with health being our starting pillar. So please do look out on all our platforms for the next upcoming webinar. And please do, there is on the screen currently, you should see, and also in the chat, sorry, there's a link to a survey where you can please rate or give any feedback or any comments on the webinar. This really helps us to improve and to see how we structure future webinars. And yeah, lastly, maybe also just worth mentioning, as Brian did say earlier, please do look out for Football Foundation for Africa's Africa Football Business Summit, which is taking place in October. And we've put links both to Policy Strategy Group and the Football Foundation for Africa's website so that you can keep up to date and get any other information you need. Yeah, so I'm going to close it at that. Thank you to everyone for your contributions and participations and for your time, and wishing you a blessed day further. Thank you.
Thank you.